GERD, that is Gastroesophageal Reflux disease, which commonly we understand as a reflux disease in our layman language. So GERD is something which is very common and it is a lifestyle disorder. GERD or gastroesophageal reflux disease is an abnormal amount of acid which is produced in your stomach and exposed to your esophagus, that is your food pipe. Some amount of acid is always produced in our stomach and that is not abnormal. But when it is abnormally exposed in your food pipe, that leads to a lot of problems. Problems like heartburn, problems like burning in the chest, cough, sometimes ulcerations, and rarely it can lead to bleeding also. And untreated GERD or unmanaged GERD in the long run can also give rise to cancerous conditions of your food pipe, and hence it is very, very important and pertinent in today's era that we manage GERD well. So if we look into the causes of GERD, there are many causes. Some are something structural or which you are born with. Some are lifestyle, and predominantly it is our lifestyle today that concerns GERD. There are structural defects, something like hiatus hernia, that is the junction between your food pipe and stomach may be too loose, which predisposes you to develop more amount of reflux. But more commonly is that if our lifestyle is something which is not very nice, if we are obese, if we are overweight, if we consume too much of alcohol, smoking, caffeine content, or otherwise if we don't live a healthy lifestyle, that does predispose somebody to develop a GERD. So these things should be managed in our lifestyle and something which is important as a cause of GERD. GERD is not only an esophageal or a food pipe disease. It is a spectrum. Symptoms can range from very mild symptoms of heartburn and burning in the chest to something which is very severe in the form of esophageal cancers also in the long run. It can, in between these spectrum, there are other symptoms like somebody can have a chronic cough, somebody can have a foreign body sensation in the throat, repeated urge to clear the throat. Lot of asthmatics have significant reflux disease. It can also give rise to esophageal ulcers. It can give rise to bleeding from those ulcers. So it's a very common feature for GERD that these symptoms may arise. To diagnose, it is your history, it is an endoscopy findings, it is the 24-hour pH manometry, and as well as high resolution 3D esophageal manometry. These are the tests which are done to diagnose GERD and other conditions which may look like GERD. On a simple case, only history and endoscopy is enough, but when you are not getting better on normal treatment, on routine treatment, advanced testing like high resolution esophageal manometry and 24-hour pH manometry are usually indicated. So routine treatment option or something, a simple treatment option, first is the lifestyle modification. I think in today's era, we all lead a stressful life, and first we what need to do is modify our lifestyle. If we consume alcohol, tobacco or smoking in any form, that has to be stopped. We can raise the head end of our bed by a few inches to decrease the amount of reflux. We can sleep on our left side, that also decreases some amount of time that our food pipe is exposed to acid. We must lead a healthy lifestyle, we must have a physical activity, we must be physically active, exercise daily, particularly your cardio routines, and you should consume less amount of caffeine. These are the lifestyle modifications that are required for you to manage your GERD better. Other treatment options are easily available over-the-counter drugs. Almost 30% of patients who do not respond well to these drugs. In those patients, we need to go much more than that. There are now endoscopic treatment options which are available. Endoscopically, we can treat GERD, we can treat hiatus hernia, particularly if they are smaller ones, grade 1 and 2. There are treatment options like GERD-X, ARMS available, where we can manage the valve between your food pipe and stomach. And in very severe cases, there are surgical options also available.